How do you plan for the birth of your baby when the cost is so unpredictable? Well, today's question comes from Brooklyn. She writes, I'm starting to feel a bit anxious about the thought of all the bills after my baby is born. I know it's a big expense, but I'm not sure how much to expect with all the potential out of pocket costs. Is there anything I can do to prepare for a large bill? Well, Brooklyn, thank you so much for your question. This was actually something that weighed pretty heavily on my own mind when I was expecting both of our babies. So, since I don't know what type of birth you're anticipating, today we're going to cover different factors that can impact childbirth expenses, the average cost of a birth at the hospital, a birthing center, or at home, how to estimate how much your birth will cost so you can financially prepare for it, as well as what to do if you get hit with a large unexpected bill after your baby is born. But before we dive into all those details, if we haven't hung out before, my name is Brianna. I'm a fellow mom and money coach, and here we talk about all things real life and money from moms just like you. I'd like to invite you to join today's conversation and drop any comments, questions, or suggestions in the comments below so that way you can help Brooklyn or any other mom that happens to fall across this episode. But with that, let's go ahead and dive into today's topic. The first thing, of course, is the factors that are going to impact your birth. And with a birth, since so many different variables can happen, they are basically unique to every individual mom. Some obvious factors are, of course, going to be where you give birth and where in the country are you giving birth. Obviously, there's different types of births you can have, or I guess different locations you can give birth, such as a hospital, a birthing center, or at home, kind of already previously mentioned. And that is going to be a huge factor into how much you may end up paying. Now, with every birth and however many medical interventions you need to have, they're also going to inflate the cost of your birth. For example, if you need to have an epidural or if you end up having a C-section, that's going to require an anesthesiologist and it's going to require, additional medical costs because of the labor and the pain and all of those types of things. Well, those all get added into the expense of having a baby. In addition to all of the medically necessary interventions during the course of your labor and delivery, there's also the length of your hospital stay. Now, based off of my source data, the average hospital stay for a natural delivery is about 48 hours, whereas if you have a cesarean birth or delivery, the average stay is 96 hours. Now, I ended up having a cesarean for both of my births, and I did not stay in the hospital that long. So this could be a factor that plays into how much your birth is going to cost. Now, a big factor in all of this, of course, is going to be your individual insurance coverage. Do you have a high deductible health plan? Do you have a, different type of medical insurance structure? Are you on government assistance? Because all of those are going to factor into how much your birth is going to end up costing at the end of when all of this is actually billed out to your insurance and how it trickles back to you. How much might an average birth cost? So, based off of the sources, they said that across the nation, an average birth without insurance is going to cost $18,865. Now, I think when they dug a little bit deeper and they're kind of sectioning out natural birth versus a C-section, a natural birth ended up being around $11,500 and a C-section ended up being about $17,000. What about those out-of-pocket expenses if you had insurance? So the national averages after insurance ended up being about $2,854. Now, this is for the United States. Now, a natural delivery is going to average around $2,655, whereas a C-section is going to tend to be a little bit higher at $3,214. So typical insurance coverages are going to cover about $16,000 of expenses, which ends up being a huge relief given the fact that, okay, we just heard that averages without insurance are in the, $18,000 range. Like, insurance is covering a lot, thank goodness, for most of us. When we look at the average fee for a home birth, that number is significantly different. So the average cost of a home birth is around $4,650. Now, this fee typically does not include labs, ultrasounds, or birthing supplies, and every single midwife that has their own practice to be able to provide a home birth is going to have different fees and different structures as well as different packages and price points. So typically, when they're talking about birthing supplies, like if you want a water birth, you'll typically have to buy a tub liner. The midwife will most likely provide you a list of things that you will also provide. So that's in addition to that labor fee for a home birth. And some midwives have you purchase a birth kit, which could include medical supplies like gloves, mesh underwear, pads, cord clamps, etc. And that is going to average around $50 to $90. Now, it is dependent again on every single midwife and their specific practices policies. So you may find a midwife that doesn't tack on these additional birthing fees, or you may have a midwife that may have a much lower fee, but then you have all of these additional items you need to purchase out of your pocket to provide for the birth. For my birth, as I already mentioned, I did end up having 2 C-sections, but I actually planned with my first to have a home birth. And one thing that I noticed in my birthing contract with my midwife is that her fee just covered her services, but then she also had 2 additional nurses that were part of her practice. Now, her nurses' fees during the actual labor and delivery, I had to pay them hourly. So depending on how long my birth actually went and they were, there taking care of me, because my midwife does not automatically come as soon as I go in labor. Like, she only shows up for active labor when it gets to the part that we're ready to push. The nurses for her practice were going to be there checking on your progress, so that was an additional hourly fee outside of my midwife services. So if you're considering having a home birth, or you're looking into the cost comparison between a home birth or a birthing center or a home birth in a hospital, just be aware that it may not be quite as straightforward as, oh, this is the home birth, midwife fee compared to what I'm going to end up paying with insurance. Like, there are lots of additional items that can be tacked on that you may not know about until you're actually looking at, and make sure you ask questions about that contract, because it might not be very clear up front about everything else that's involved. Some moms, knowing that they're going to have these large expenses with their births, will choose to evaluate their insurance plan and then possibly change their insurance plan during their open enrollment period to make sure that they're getting the best coverage for their anticipated birth. For example, Lindsay, she said, I knew that childbirth was going to be expensive, so I did a lot of research on insurance plans before I got pregnant. I found one that had a lower deductible and copay for maternity care. It ended up being a great decision because I saved a lot of money on hospital bills. I would definitely recommend shopping around for a plan that meets your specific needs, especially if you are expecting a baby. There are certain enrollment periods for insurance plans. Typically, it happens around October and in the fall for most corporations. So just be aware of that you may not necessarily have the option to change your insurance before you give birth, depending on where in your medical year you are. So at this point, now that you know the average cost for an actual birth, you might be wondering, how do you know how much your insurance plan is going to cover? So one of the things that you're going to want to know is, what does it cover? What are your deductibles, your copays, and your out-of-pocket maximums? Now, there are all of these terms can very easily get confusing. So essentially, you want to understand what your coinsurance and how the rate that relates to your out-of-pocket maximum. So in 2023, some were averaging as high as $9,100 for most types of insurances. So just because you have a deductible that's a specific amount, your out-of-pocket maximum is the final number that you want to be aware of, because your deductible might be, let's say, $6,000, and then you pay co-insurance up to your out-of-pocket maximum. So when you're looking at your specific insurance plan, make sure you understand the differentiation between all of those variables. Now, some out of pocket costs will be lower if you've already reached your annual deductible. But if you haven't reached your annual deductible, then that's, of course, going to mean that you're going to pay more for your birth, your prenatal, your maternity care, all of those things until that deductible is met. Now, if you've already met your annual deductible, then your out of pocket costs are going to be much lower, but just be aware that you still may have to pay until you reach that out of pocket maximum for the entire year. Some insurance plans will provide a cost of care calculator where you can type in your specific birthing center or hospital that you're planning to give birth, and it may ask you some additional variables like, is it a planned C-section? Is it going to be a natural birth? How long might you end up staying? So that way it can give you a more realistic amount based off of your specific circumstances. Just know that things might change once you go into, labor and delivery, like we already kind of touched on a little bit earlier. Other types of insurance plans may not have those internet features available where it's going to let you type in all of these different variables and spit out a nice little number. Some are going to have more like charts and graphs or tables that you might have to look at, or you may have to dig more into the details of your specific policy to find this type of information. Of course, definitely making sure that your hospital or birthing center is in network, and not just the hospital, but also your primary care provider. And so typically most primary caregivers like the OBGYN are going to be in network at, you would think that they would be in network at a hospital if the hospital's in network, but that doesn't mean that every single provider at the hospital is considered an in-network provider. So I know this is kind of like, well, isn't that like splitting hairs? But you would be surprised at some of these strange variables that get involved when it comes to insurance. Now, it could also be a factor that if you go to an in-network hospital and then the only physician on available, like working the floor, is an out of network physician, in those situations your insurance may like consider them to be like, oh, well, that's an in-network provider for this circumstance. It's all going to be dependent on how your insurance policy is specifically set up and how they look at all of those factors. But just be aware that even if you are going to an in-network hospital, make sure you're also pairing that with an in-network provider, especially on those like routine medical visits. You don't usually have quite as much control over that when you actually give birth. When it comes to a home birth, it's completely dependent on your specific insurance plan. So some insurance plans will have you pay 100% of the cost of a home birth yourself, but it may end up counting towards your deductible or your out-of-pocket maximum for the year. So it kind of depends on what type of insurance plan you have, and again, those specific policies as it relates to your coverage. As well as, does your midwife need to meet your insurance's requirements for a planned home birth? So just because they may cover a home birth, that doesn't necessarily mean that your midwife kind of qualifies to be a home birth provider for your insurance to kind of count or cover some of those expenses. So just as you could go to an in-network hospital, that doesn't necessarily mean that your primary OBGYN is an in-network doctor. Some insurances are going to want to see certain accreditations or licenses for your midwife, and this is again why you want to specifically check within your insurance's policies. Some might require accreditation from the AMBC or the American Midwifery Certification Board, or the NACPM or the American Association of Certified Professional Midwives. So I'll link both of those resources for you below. This is also a great way to go and see if the midwife that you're considering is certified and licensed and has just a higher level of education and experience to see if they are part of either of these associations. So, the specific midwife that I chose for my home birth did have to have one of these certifications to be considered to be qualified to be able to provide my home birth through my insurance plan. And I, as I mentioned, I did end up having to have a C section due to medical complications. If you're interested in that whole birth story, I will link the episode below. But if you haven't given birth, maybe wait until you've given birth before you watch or listen to that episode, because I don't really want to traumatize you, especially if you are planning to have a home birth, because of some of the complications that I ran into specifically that I wasn't anticipating. So maybe give birth and then come back and listen to that episode if you're still interested. And finally, another big thing to look at when you're going through all of your insurance details is if you are going to be changing insurance plans, make sure you're comparing each insurance plans based off of these specific variables to look at and compare the coverages. Some plans are really good about kind of showing you the cost comparison between each plan, and other insurances are not so great at that. So at least you'll have the information to kind of know what to look for and where to get started. If you're feeling a little overwhelmed, then one thing that I might recommend is to join my email list so you can be aware of any workshops that are coming up to specifically cover these steps. Or if you need one-on-one help right away, then you can find my contact details below for a one-on-one consultation. Now, at this point, you might be wondering, how much is your birth going to cost and how much will your hospital charge? So, depending on if you're having a natural birth, some hospitals may request you to pay a down payment. Now, some parents may find this a little bit challenging since with a natural birth there's so many variables and so many things can change. The price point for what your hospital may need to charge your insurance isn't really finalized. So if you end up needing more medical interventions, or if what they priced you ended up being far less than what you actually need, maybe things were going well and you got discharged sooner, then they're going to bill your insurance, and then instead of your insurance just saying like, hey, this is the amount that you owe the hospital, you then end up having to seek reimbursement from the hospital if you pay too much. And some parents can just find that a big hassle. So just be aware that if they are offering you a discount if you pay your medical bill up front, that evaluate for you if it's going to be worth kind of trying to like figure out and like hound down getting a refund from them if you're due one after everything is cleared out and charged through your insurance plan. Now, if you're having a routine scheduled C section, that's a little bit different because with a C section, they already know what they'll need, what the expected cost is going to be, as well as how much your insurance will cover or pay them, because they're going to know your insurance plan up front, which was actually the case with my situation with my second, because I ended up having a scheduled C section. My first birth was traumatic enough. I didn't need to do that again. So, with my scheduled C section, they called me a couple of days before my procedure was planned to take place. And they said, hey, this is how much it's going to be. We already ran it through your insurance, so we know how much they're going to pay. If you pay everything up front in full, then we'll give you a discount. And I believe the discount was around 10%. So, as we already talked about earlier, how much a C section can cost with insurance, having a 10% discount meant that I saved hundreds of dollars. So, it was totally worth it. Now, if you don't have the funds to be able to pay that huge bill up front like that, a lot of hospitals will also provide payment plans. So discuss with them what your options are. A lot of them will be very flexible. I have, heard from different moms that it's kind of can be very dependent on what your income is and how much you can budget. So just have that conversation with your hospital, and if you need to, they usually have a financial aid office that you can go to as well to use those resources. If you find yourself in a position where you do need government assistance to cover the expense of your birth, I do have an episode that covers different programs and resources available for moms. I will link that episode below so that way you can find out more details for your specific situation. If you do find yourself left with a large hospital bill, then you can probably relate to Tess. She wrote, I found out about a financial aid program through my hospital. I applied and I was so grateful when they approved me. It made a huge difference and took a lot of stress off my shoulders. I would definitely recommend checking with your hospital or healthcare provider to see if you qualify for any financial aid. So, when I worked at a hospital in my college years, we actually ended up having like a survey that was sent out to all of the employees of the hospital of extra funds somehow that became available to the hospital, and we got to vote on what we were going to use the funds for. And some of it was like make a beautiful courtyard, or update some furniture or some of the interior. And one of the options was actually to pay off the outstanding balance of any patients that had large overdue bills. And I was so pleased to find out that that was actually what the majority of the employees ended up voting for. And it was kind of cool because later in my life, when I was in a situation where one of my family members had gone through a major surgery and we actually needed to have some financial assistance, I worked with the financial aid of a different hospital, and we went through the application process and was so grateful when they actually approved that 100% of our medical bill was going to be completely covered. It was just so nice to kind of feel like, hey, I I ended up being on the receiving end of that generosity from so many years before. So if you do need to take advantage of a program like that, there are programs there. And I was speaking with the financial aid advisor when I was going through that experience, and just kind of, I think she could probably tell that I was feeling just like a little overwhelmed and a little bit sad to find ourselves in the situation that we had a huge medical bill from a surgery that was far more than we anticipated ever needing to spend because of how our insurance worked out. And she ended up saying something to me that was really comforting. And she said that the hospital raises funds as well as receives donations and grants to be able to specifically pay for the needs of patients like me in that situation. So she said, don't feel bad. This is what these funds are here for. They're here to specifically help people. So if you do need to take advantage of that or find yourself in a similar situation, please don't let any shame around you in your situation keep you from seeking out services that you may very well qualify for. That's what they're there for. Well, now that you know what your birth may cost, you might be ready for something a little bit more fun, like what should you pack in your hospital bag? Or in my case, what were the few things I wish that I had with me? So if you're interested in that episode, I'll link that one up for you next. But as always, until we hang out again, make sure you create a home your heart loves.